Good evening, and welcome to the 30th Annual Nancy Weaver Emerson Tree of Hope Ceremony. My name is Mallory Thompson, and I am the Administrative Director of the Duke Cancer Patient Support Program. It is an honor and a privilege to welcome you to this virtual event. This year, our Light of Hope honorees are our healthcare heroes. This past year has proven to bring about new challenges to healthcare and cancer care across the world. During this pandemic, our nation has been given a glimpse of a day in the life of a cancer patient. Our support services abruptly adapted to secure our mission in support of families facing cancer at Duke. Anyone who has been witness to a cancer diagnosis understands that cancer impacts the community that supports the person diagnosed. Tonight, you will hear two stories about those who have been impacted by cancer and received services from our cancer support team. Sarah, a breast cancer patient at Duke, describes the comprehensive care provided to her by Dr. Lola Fayanju, a breast surgical oncologist. Sarah shares about the therapy services she received by Parker Anderson and the medical family therapy team, which afforded her the opportunity to heal emotionally as well as physically. Jennifer, a lung cancer survivor at Duke, along with her husband George and two sons, Logan and Liam, extend enormous gratitude toward Hannah Sasser, who provided guidance and comfort as she navigated the difficult task of explaining cancer to her sons. Jennifer expresses the importance of the integrated services provided by the Cancer Patient Support Program throughout her cancer diagnosis and survivorship. Cancer impacts individuals, families, and communities. Cancer does not discriminate, and neither do the imperative services that the Duke Cancer Patient Support Program offers. That is why we continue to work diligently to provide our comprehensive services free of charge to ensure access to all. Our program was founded on the idea that the weight of a cancer diagnosis should not be carried alone by any person or family. We are here to partner with any Duke cancer patient and their family to ensure we provide a place of support, comfort, and community. Now let's welcome Sarah Pitt-Smith and her husband, Myron.
My name is Sarah Smith Pitts, and I live in Fayetteville, North Carolina. I am a wife, a mother, a friend, a daughter, a sister, and a colleague. I've been married to Myron for almost 10 years, and I'm the mom to Samuel, who's 7, and Helen Ann, who's 5. I serve as the associate pastor of the United Methodist Church here in Fayetteville, and I'm also a chaplain with First Health Hospice. In November, I went to see my doctor, and she referred me on to other doctors. And so throughout December of last year, I visited various doctors in Fayetteville having biopsies and scans of different sorts. And then on December 23rd, I was diagnosed with cancer. We set up appointments for December 31st with other doctors here in Fayetteville. But I also scheduled second opinion appointments for Duke, and that was going to happen on January the 7th. So there's a lot of waiting and wondering as we approached those two appointments. When I got to Duke, it was kind of intimidating because some of the greatest minds work there. And I remember the first appointment I had was with Dr. Fayanju, and so she comes in and smiles, and she was just very approachable. Ultimately, I decided to have my chemo and radiation here in Fayetteville, and then to go to Duke for my surgery. And so Dr. Fayanju and the folks at Duke worked with the team here in Fayetteville at Cape Fear, and that worked out really well. I started with my chemotherapy, and everything went fairly smoothly until it didn't. And then I was hospitalized for about 12 days. I got her out of the hospital and still not feeling very well. And one Saturday morning, I think I was still in my pajamas, my phone rang, and it was a Durham phone number. And So I knew it had to be someone from Duke, and I answered it, and it was Dr. Fyanju. And so we talked about what had happened to me in the hospital and how really I'd been through a very difficult experience. And I think until she said that, I didn't know how difficult it was. I think everyone else around me knew, but I didn't know. I was still figuring it out. And I appreciated that she was just kind of laying out some options for me in case I would need them. And so she was just making me aware of choices that I had. And so it was nice to know that I had choices in this. During that conversation, I think it became clear that there was a lot on my mind, and the pandemic had recently started, and so we were dealing with the effects of that, homeschooling, and I had been furloughed, and just the list went on and on and on. And she asked if I would like someone to talk with, and said that there are therapists at the cancer center. And so the next week, Parker Anderson called me, and so he and I have been talking a couple times a month for a while now, and it's just been very helpful in figuring out my place in this journey, and where I have where cancer is not going to win, but I still have my life. I still have a role in everything, where I can continue to be me, and that cancer won't take it all away. At the end of that phone conversation, Dr. Fyanju said, go outside today. It's a beautiful day. And so we're in the midst of this pandemic, and there are so many rules about what you can do and can't do. I'd just been in the hospital where there were rules about what I could and could not do. And it was almost like in that moment that she gave me permission to live my life and to do things that I needed to do. She wasn't looking at me as just a person with a breast that had cancer in it, but she was looking at me as a whole person, and knew that getting outside would really help my mind and my heart, which in turn would help my entire body. At the end of it, I looked at my husband and I said, "Did Dr. Fyanju really just call me?" And he said, "Yes." And so for the next couple of days, "Did she really call me?" "Yes." I think in the past I've thought about doctors kind of dictate what you were allowed to do, but she gave me some choices, which was very helpful, and was walking alongside of me during a difficult time. And throughout all of this, she and all the folks at Duke were partnering with me in this journey with cancer. This is a journey that you never want to go on, and one that just doesn't make any sense at all. But to have people with you along the way helps to bear some of that burden, and it makes all the difference. It helped not only me, but it helped my entire family. Talking with Parker has helped me to figure out how to be a wife and a mother and a person in the midst of having cancer. And so that has benefited our entire family. We also had another therapist meet with us via Zoom at one point right before my mastectomy. And he talked with the kids, and he told them that they would be bouncing off the walls, and that was fine. They would do that if they were in his office. And of course they did that. But it was helpful to them, and therefore is helpful to us. And it really eased our minds in terms of all that we had facing us. And there have been other folks at Duke who've been there for Myron and I in this journey. And that has been just so wonderful, as there's so much that it takes from you. and it could weaken you, but I would say that the resources that Duke has offered us has made us stronger.
It's a whole family experience. We have tried to keep them looped in as much as possible, but they're also age 5 and age 7, 5-year-old girl, 7-year-old boy. And so there's a lot they don't understand. So we try to demystify the process with them, but not scare them as well. So, and I think really Duke and the resources it has provided has helped with that. Anytime you come up with a way to talk to your children about cancer, about what their mother was going through, what the family was going through, it's always a net positive.
Cancer has certainly been a change in my life and in my family's life. It's been something that we have really had to adjust to. And so when I think about someone who might just be stepping into this journey that can be sad and terrifying and maddening, I would just encourage them to reach out and to know that you are not alone. There are people around you who care, and there are folks at Duke who, like Dr. Fyanju, like Parker, and like all the other wonderful people who really care and will help you and find resources for you, just as they did for me. And it makes the journey not as hard. It makes it bearable, and it means so much. Just in every day, it means so much.
Thank you.
First, I just want to say thank you to Sarah for sharing your story and being willing to be vulnerable. This year has been about vulnerability and change for you and your family in so many ways, many that you have not asked for. It has been a privilege connecting and learning from your story, and it has also been an honor to watch how you've approached this experience with authenticity and humanity. I think we too often ask cancer patients and their loved ones for their strength, when what they really need is a safe place to feel deeply and grieve as their lives change. What I love about being a medical family therapist is that I get to help patients and their families cut through the noise of a cancer experience and remember who they are at their core. I learn so much from the patients and their loved ones I work with about what it means to stand up in the middle of a storm of fear, grief, anxiety, impossible choices, and changes in identity and relationships and say, oh wait, I remember who I am. Medical family therapy is available to patients and families as a reminder that they are not alone, and as a service aimed at helping them find agency in a transformation that too often feels like it is out of their hands. None of this would be possible without providers, without healthcare heroes like Dr. Fyanju, who recognize the complexities of the whole person, who know that treating cancer is only one step towards a fulfilling life. It's important to me that the work that I do as a part of the breast and GYN provider teams is centered on working with and advocating for women. And it's no secret that women, especially women of color, experience disparities in their care that threaten their lives and well-being. Dr. Fyanju is a provider that recognizes that it's critical to treat the individual as a whole person, while also confronting systems that give less space and visibility to the most vulnerable in our society. It's certainly my privilege to introduce Dr. Fyanju, a provider and a person who I respect and who I'm grateful for the honor to work alongside.
Hello, I'm Dr. Lola Fyanju, and I'm a breast surgical oncologist here at the Duke Cancer Institute. I feel incredibly blessed to have the privilege to take care of patients like Miss Sarah Pitt-Smith and her husband Myron and their beautiful children, and get to be with them on the incredibly daunting and important journey of treating her cancer. One of the privileges of being at Duke is that we are able to offer patients a wide array of services that engages patients as partners in their own care. It allows us to be able to take care of the patient as a whole person and not just as someone who's dealing with cancer. We address their relationship with their families, their relationship with each and every provider they meet, and we help them deal with all the different emotions that come with having cancer. I feel incredibly grateful to people like Parker and other members of the support services program here at Duke who allow patients to fully express themselves during this very difficult time. I know the term healthcare hero is used to talk about people like me, but there are so many heroes involved with this process. There are the people who clean the rooms. There are the individuals who make and bring us food. There are the individuals who draw blood and the individuals who give life every day through medications and treatments. And all of us work together as a team to help patients get through cancer and get to the other side and hopefully have it just be a blip in their otherwise long lives. Cancer, I always tell patients, is in many ways like having a new experience and learning a new language, and that we have to work together to learn that language together and to get people through a new experience that they've never had before. And so when patients begin their cancer journey, our goal is to accompany them all the way, to help them get to the end of that journey as a team, on their team, such that they have a successful outcome and their whole family is included in it. Again, I feel incredibly privileged to take care of patients like Ms. Pitt-Smith and her whole family, and grateful to the many colleagues I have in support services and other ventures at Duke that allow us to care for the whole patient. And importantly, these services are free to people who come to Duke, because we recognize you can't treat cancer without treating the people who have them. With that, I'd like to introduce Ms. Jennifer Balme, who is a stage 2B lung cancer survivor, one of the many people who I consider to be healthcare heroes, along with my own patients here at Duke Cancer Institute.
Hi, I'm Jennifer Balme, and I was diagnosed with lung cancer in December of 2018. Officially on Christmas Eve is when I heard the news, and very shortly after, on January 3rd of 2019, I had lung surgery, and shortly after followed with chemotherapy for 4 cycles, and that was through May of 2019. After the chemotherapy, which ended in May of 2019, was sort of what I consider really my recovery and survivorship phase, as I continued with surveillance at that point every 3 months to present day. And thankfully, each scan has come back as clear, no evidence of cancer or disease. I think no matter who you are, how strong, how capable you are of compartmentalizing anything, when you first hear, at least in my experience, what's going on, there's just that feeling of, when you hear cancer, it's definitely a feeling of it's going to be a terminal situation, or at least something really awful. And I think, for me, I did have the benefit of, I have a big family and all of that support, and Christmas the next day, which was right after my diagnosis. And I say that, but in a way, in all seriousness, it was a gift. And I still, to this day, believe that that I had the diagnosis when I did personally, because it wasn't an incidental finding, and it wasn't something that was expected. And, I wasn't at the point of stage 4, which oftentimes that's the case with the type of cancer I have. And so it's not lost on me that it was a gift, that it was found, and just take each day and find your strength in what you can do, not so much as, what you can't or what it could be. What's great is that I know that there are so many more resources. It's just a matter of time and need. For me, I even think back to when I was in the hospital after I had my surgery, the lung surgery. I was in the hospital due to having fluid and needing a thoracentesis and all of that. And even before I had the treatment, the chemotherapy, I had the fortune of meeting with a nurse navigator, Sandy Sonessa, who is now retired. So she was able to share with me just a bit of information in terms of who the oncology team is, and making some connections, held my hand and reassured me, and just asked me what I needed, and she continued to do that all throughout my treatment. Aside from the dealing with the disease, I had to think about how I was going to tell my children, and also be able to get through that conversation, and that there was a guide. It was essentially scripted, but having that benefit of meeting with Hannah prior to even speaking with my kids was just instrumental for me. Through the Kids Can meet, which on the one hand is great for the children. You know, they're in a place where we all share in common, whether it's a mother or a father, a caretaker who has cancer, and being able to talk about that, and but in a way that's fun. There's whether it's crafts or some sort of exciting event for the kids and little treats and all of that, getting them comfortable and being able to connect in that way, and also allowing the parents, the individual or couple, a lot of times it's spouses that will join and will branch out and go into another room, and that's just really an opportunity to sort of talk about what it's like being a parent that has cancer, having children, how to deal with that, the struggles from the physical and the emotional, and how to cope and also support the children, whether it's directly, indirectly, and again through the program. Unfortunately, it's only, it is a limited amount of time, but it goes a long way. I just still feel so grateful that everyone has been so accessible, and just also always kind of going that extra mile just to make sure that I'm comfortable, and my children are comfortable, and they continue to meet still with Hannah and Patrick and Kids Can group. That for me is just a great relief, knowing that they're cared for as well. I haven't tackled or, at this point, I'm gotten to a point of being a survivor of lung cancer by myself. And one of the first of the many that have supported me along the way was Dr. White. And Dr. White is my thoracic surgeon, who I continue to see every few months. And after Dr. White was Sandy Sonessa, who again is the nurse navigator, and I just had the fortune of meeting her when I was in the hospital, and from there she was able to introduce me to Dr. Garst, who is not my actual provider. She's not my oncologist, but I'm just so impressed and appreciative with her, and I just want to mention, emphasize that she is not only tremendous in terms of, from Duke Services, but also working with LCI, the Lung Cancer Initiative. She does so much to advocate and inform. From there, Dr. Garst had referred me to Dr. Smith, who is my oncologist, and his wonderful team. I've been working with Catherine Majestic, who is the psychologist I mentioned, and who I will admit I was really questioning and resistant as to whether I wanted to do that sort of outside my box. But I mentioned that, and, really assert that service and support is there, because I wasn't sure I needed it, at that point, but it has been one of the best things I've done post-treatment. And she's just been able to continue to chip away at me and help me work through, whether it's anxiety regarding, potential recurrence, to just all of sort of what's happened to my body and everything in between. Just understanding the specific needs and concerns of cancer patients is just what the doctor ordered, and he did, and it worked for me. Yeah, once you sort of, get through everything and you have that quiet time, you probably will need someone, to actually talk it through. Kids Can, Hannah, Patrick, and team can't, stress enough how tremendous that group is. And if you don't know about them, find out about them.
Thank you, Kids Can. Can't wait to see you in person.
Thank you.
Thank you, Jen, and thank you, Logan and Liam. We can't wait to be together again for Kids Can too. I'm glad we still get to see you virtually. I enjoy having the opportunity to work with these wonderful families. I love what I do, and I love helping people. It is my pleasure to provide education and support during these defining moments in not only the patient's life, but also in the lives of family members, which often includes children and teenagers. As a child life specialist with the Duke Cancer Patient Support Program, it is my mission to provide developmentally appropriate education and supportive care to the whole family. It is an honor to offer these opportunities that foster open communication and trusting relationships in the home throughout the cancer experience. Providing knowledge and emotional support to children and teens who are affected by their parent or caregiver's cancer diagnosis is empowering to the family as they face the challenges, changes, and uncertainties that a cancer diagnosis brings. During this time, when relationships and important routines have been interrupted, consistency of ongoing family support is even more important. When I engage with children, I am frequently reminded of their resilience and their desire to be hopeful. Through Child Life Services and other types of supportive care provided by the Duke Cancer Patient Support Program, we seek to provide a sense of hope in knowing that you and your family are not alone in your cancer journey. From diagnosis through survivorship, we are here for you and your loved ones.
Good evening, everyone. I'm Steve Paterno, Deputy Director of the Duke Cancer Institute, and I'd like to extend my warmest welcome and appreciation to all who have joined us this evening for the 30th Annual Tree of Hope ceremony. Welcome to our patients, caregivers, friends, and partners, and special thanks tonight to our speakers, Sarah Pitt-Smith, my dear friend Mallory Thompson, Parker Anderson, Dr. Lola Fyanju, the Balmain family, and Hannah Sasser. Let me also take this moment to extend further appreciation to all of our healthcare heroes who, despite the challenges and uncertainties of this global pandemic, show up day after day to serve our patients. They are selfless heroes in the truest sense of the word. In past years, I have shared my own reflections on the meaning of hope, but this year my thoughts have been drawn to the symbolism of the tree itself. Two thoughts have come to mind: resiliency and connectedness. The first relates to the scenes we have all witnessed on the news of the devastating fires out in California, and to a different scene from one of my favorite movies, The Lord of the Rings. In both the real-life devastation and in the movie, after an epic battle against the fire or against evil, a sapling springs forth as a symbol of hope and resiliency. Our trees tonight, both here and in Raleigh, symbolize that hope that springs forth from the human spirit even in the face of the battle against cancer. My second thought relates to the current craze in the news and on TV about our genetic ancestries and the images we have all seen of the graphic representation of a family tree. Here, the image of the tree underscores our connectedness. We are all branches connected to the same tree trunk of both humanity and the divine. Tonight, one of the themes you have heard is that we are a community of people, patients, providers, and caregivers who are connected to each other's journey. We support each other, we learn from each other, and respect each other. Tonight, I am grateful for that connectedness, and I pledge our ongoing commitment to support you on your journey. I want you to know that we at the Duke Cancer Institute will be there for you to provide supportive care for you from diagnosis through treatment and through the continuation of care into survivorship. So with those thoughts in mind, I will now light the trees of hope in both Durham and Raleigh. Thank you, everyone, for attending tonight, and have a great evening.